Good morning, everyone. It's a pleasure to be here presenting at this premier conference on AI in healthcare. So my topic today is going to be digital pathology. I am not a medical professional. I am a computer science student by background from IIT Kharagpur. And so I'll be talking more from a technologist's point of view rather than a clinician's point of view. But the stories I'm going to tell is what should drive us technologists to do better for applying AI in healthcare. So every technology which comes in has a hype cycle. It starts with very inflated expectations, and then the expectations are not met. It goes into a trough of disillusionment. Okay, this is absolutely rubbish. It does not work for anything. And then we realize that, okay, there are many things that a technology is useful for. And right now, I believe, as an AI practitioner, I believe that we are in that so-called hype cycle of the AI phase. I mean, we see outlandish claims and predictions being made left, right, and center. And I think the one at the bottom probably takes the cake, and which Dr. Manikam also kind of pointed out very succinctly and in the previous talk. But the reality is something which is entirely different, as we can see on the right. And there's also another point that I wanted to kind of bring out here is that there is a lot of hype around autonomous vehicles, which is basically application of AI into navigation, right? But is that the right use of capital? And there is a humongous amount of capital which is being thrown into that problem. But is that the right use of capital, or should we invest into better public transport? So when we invest into AI, we should also think of these questions. The bottom line here is that we should try to avoid the hype cycle and realize which are the tasks that a certain technology is useful for ahead of the curve. If we identify those and start using those from day one, developing those from day one, we will have systems which are actually usable rather than just hype. And in my opinion, and also I'll actually borrow from what Dr. Manikam said just before, is that AI is very good at assisting humans to do their routine, mundane, sometimes even grunt jobs. And that is what we should try to focus on. And in today's talk, I'm going to talk about not about technology so much, but more about real-life stories on how AI is actually helping pathologists on the ground. And we work in hematology, so in fact, all of my stories will be related to hematology in some shape or form. Before we go there, I have to just kind of tell you what is the system that we are talking about, which is helping the pathologists. It is essentially a digital microscopy system, which takes in the humble peripheral blood smear slide, scans it, and applies AI to basically automate the grunt job of the pathologist. It does WBC differentials, RBC morphologies, and platelet morphology detection. But that is not the important point here. The point is actually the real stories that we are going to talk about. So the first one is from a small town, a very small town in Maharashtra. A child comes in with just complaint of fever, no previous clinical history. There is an automated analyzer, the CBC cell counter, which flags a normal leukocyte count, but some abnormal cells. So the pathologist gets curious, and the pathologist actually is not on site. He is in Pune, and this is in a separate city. So he orders the technician to run it through a scanner, and the scanner throws up 65% blast cells. Now, a diagnosis of cancer is never a happy news, but the good part here is basically that the AI was able to detect the cancer early without having any external symptoms. The clinician was alerted, the child's treatment was started. Hopefully, the child is doing better now. And I'll just quote the pathologist here, is that this case reaffirmed our belief that AI-powered hematology is a game changer. We now have a powerful ally in the fight against blood cancers. human life is invaluable, and early detection is our best weapon. The next story is again from another small town in Maharashtra. Here the ending is not so happy, but what the AI did here is basically ruled out some obvious possibilities. It said, okay, it is not leukemia, it is not a case of sepsis, yet the WBC counts are very, very high. So the pathologist in the dead of the night calls up the pediatrician and tells, you can rule out these causes, look for other causes. And that got the pediatrician to think harder, and finally the child was detected with rabies. Unfortunately, as I said, not all stories have a happy ending. We lost the child. But at least what the AI proved useful here is to make the clinician think harder by ruling out the most normal causes for such things.